A new report from the Black Women's Institute for Health is the first of its kind to look into the struggles Black women face when accessing health care in Canada.
We've never looked nationally across the board to really understand what Black women are experiencing. And what it showed is really that we are in crisis, that we have been invisibilized and ignored, and it's harming us. So, some of the stats that stick out for me, it's 42% of Black women that completed this survey told us that they had delayed or avoided seeking care from their provider because of fear of how they would be treated.
Sophia Amon is a BC resident who says her experiences mirror what was found in the report.
I've definitely waited a long time to seek care because of negative instances that I've had, and just feeling that disheartening sense of they don't care about me, they don't care if I live or die. I think when we're not believed when it comes to our health concerns, it can keep us from seeking care, timely care, which can take away the opportunity for early intervention, but it can also create and worsen disability.
The report also showed that Black women often burn out and struggle with emotional fatigue through toxic work environments and racial discrimination.
We asked Black women what their top 3 chronic conditions were. I wasn't expecting to see mental health, but mental health was the number 1. Hypertension was the 2nd, and fibroids were the 3rd that they were managing. And when we looked at mental health, 27.4% of Black women told us that they had had thoughts of self-harm.
The report includes over 70 recommendations for federal and provincial governments and stakeholders such as hospitals. It also found representation is critical for Black women to feel heard about their medical concerns.
When Black people have Black doctors, our outcomes are much better. And so if we know that statistically, then we really need to do better at recruiting and sustaining these Black physicians.
Allyship is important, advocating on behalf of better healthcare systems, but also believing Black women simply.
In Vancouver, Angelina Ravelli, City News.